Good morning, everyone. My name is Deborah Peter, the Menstrual Hygiene Management Manager. I'm currently working with IRC Nigeria Country Program. Today, I'm presenting on Menstrual Hygiene Management Inclusive Program, MHM in Emergency. My presentation outlines include overall objectives, IRC program in Nigeria, MHM achievements in IRC program. What are the MHM needs of women and girls? Cultural beliefs and taboo on menstruation. MHM activities and results. MHM learning initiatives. Challenges, way forward, and conclusion. The overall objective of my presentation is to understand ways of improving MHM in emergency contexts, IRC progress and learning on MHM intervention in Northeast Nigeria. Currently, millions of vulnerable people in Northeast Nigeria are facing a humanitarian and protection crisis due to conflict. 8.3 million people in need across Northeast Nigeria, in which 31% are said to be girls, while 22% are women. IRC started its intervention in Nigeria October 2012 in Kogi State, and currently IRC is working across Borno, Adamawa and Yobe States, as well as rendering emergency services in Zamfara State. IRC started its MHM programming in July 2018, and till date, we've distributed 20,000 MHM kits to women and girls to ensure they manage their menstruation with safety, dignity, and privacy. And also, we've spent 315,000 USD. So far, we'll be able to reach 75,000 clients on menstrual hygiene management response. Falmata Mohammed from Kondoga IDP camp stated that, in the past, I don't feel comfortable going to public places when I'm using bits of clothes. The reusable pad is more comfortable, and I feel more confident in public places when wearing it. This is a testimony from one of our clients after receiving the MHM kit from IRC. Before starting an MHM response in a contest or in any of the program, there is need to conduct an assessment to know the needs of women and girls. And globally, some of these needs are: 1, access to materials and supply, MHM information, as well as MHM supportive and facilities. Some cultural taboos and restrictions behind menstruation. We have cooking or using utensils. Women and girls are not comfortable during menstruation using cooking food or using cooking utensils to serve their husband while menstruating. And we have participation in religious ceremonies, praying or touching the holy book, being near or sleeping with their husbands, others seeing their used menstrual materials and using for diabolic purposes. So women are not comfortable like other people, for other people to see their menstrual materials. They feel if other people will see this material, they'll use it for diabolic purposes to harm them. For the target group, we are targeting adolescent girls and women of menstruating age, women-headed household, disabled adolescent girls and women, unaccompanied adolescent girls, vulnerable women based on referrals from other sectors. We also work with other sectors to conduct these activities, which include we have the protection sector, we have the health sector, as well as the education sector. Journal published in collaboration with Columbia University. The aim of this journal is to fill and identify gaps in the MHM response literature and guidance around menstruation, and also disposal of laundry of reusable materials. IRC also piloted the female-friendly toilet with the MHM suit. This is to ensure that women and girls have comfortable place to dispose their used menstrual materials. And this pilot was accepted by women and girls, and they feel comfortable in using this and suit in disposing used menstrual materials. It is important to continue prioritizing MHM during emergency intervention. Women and girls are not comfortable discussing MHM with male gender, so they don't feel comfortable because they feel it's a thing of secret, so they are more comfortable with female gender. Cultural norms and taboos is restricting women and girls' capacity to manage safely MHM. Risks of health complications among women and girls. Way forward, advocates for inclusive of MHM in WASH programming and emergencies. Engage women and girls on coaching and mentorship skills program to ensure sustainability, including MHM in schools curriculum, and also develop local capacity in the production of MHM materials. This will help the women to know how to produce these materials themselves if humanitarian partners are no longer there to support them with these supplies. So you are involving them in skills, building their capacity on how to produce this material, so it will help to go a long way. Thank you.